the health officer for the county of Wayne Carroll Osterbury. And I believe the job title is COVID coordinator for Dr. Mohamed Hamami. Welcome back to public service, Dr. Hamami. Who's taken the lead on this?
I believe I am, Mr. Chair, and the title is Chief Health.
You don't look like either one of those guys.
And the title is Chief Health Strategist, but I'm happy to be back and supporting all the wonderful and great efforts that our public health department has been doing under the leadership of Director.
It's good to have you back, sir.
Thank you. Be back.
Mr. Chair.
Yes.
I'm sorry to interrupt, but before we begin, if we have any questions, should we ask them during the presentation, or should we hold questions till the end?
I appreciate that, Commissioner. I definitely prefer the holding them till the end and people writing them down. I forgot to mention this at the beginning. I think it goes smoother. And then when we do get to questions, if you raise a question that other people also have comments on it, we will go by strand at that point, right? Issue by issue as people raise them with their comments and allow other commissioners in. It's always difficult to do these kind of things, and I don't like having scattered questioning all over the board. So if it's okay, commissioners, if you can drop a few notes as we're going on things that you want to ask about, and then once we get through the presentation, we'll go through, we'll do it like Congress does it. What the heck? So, all righty. Thank you for that. Okay.
I think,
Dr. Hamami, are we ready?
Yes, sir. I think I'm going to try to share my screen. Please let me know if you can see the presentation.
There you are, sir. Yes.
Wonderful. So you can see the presentation. Great. So Carol and I today are going to give you an update on where we are as well as our strategy going forward. And many people talk about a second wave versus a first wave, but we are continuing to see a spike in the first wave. I think these are all semantics that are not really important as much as the true picture, which shows us in this graph that we are experiencing an uptake and an increase in cases. In fact, this is the graph for as of today in Wayne County. And as you can see, in November, we have exceeded the number of confirmed cases that were during the peak of the pandemic in March, end of March and early April. So the trend going in the opposite direction for the confirmed cases. However, if we look at the death trend, then it's completely inverted, and we have lower trend as we are proceeding. So a lot of people question whether we are experiencing a second wave or not. We do not have a period where our cases were very low, close to zero. So I would agree with Dr. Fauci that we are seeing a continuous of the same wave, but then another peak. But again, that makes no difference in terms of the preparations. These two graphs are very important also to understand what is working and what is not working. So these are from the IHME, which is the site that has been designated by HHS to project how we are dealing with. And as you can see, there is this part of the graph, which is in dark purple probably, that shows until today. These are real cases, but then you have those three dotted lines. One that is a continuum of the purple graph, one that is in green, that is the lower part, and one that is in red, that shows the spike. And the top graph is the United States. The bottom graph is Michigan. Unfortunately, the IHME or IMS website does not go to the county level. What we're working on with our data people is to try to mimic that same graph for Wayne County. Basically, what that tells us, if we continue doing what we are doing now, then we will be on the middle trajectory in Michigan, where we will see another slight peak and then a plateau declining. If we ease the mandates and the mitigation that we have in place, i.e. no face masking, gathering is open and all that, this is the red line that shows you how cases are going to increase in a very steep way. If we put more enforcement on universal face covering and mandate masking, then this is the green one that certainly shows you a lesser curve and a faster decline. So the emphasis is to say that whatever we have in place, those measures are very important, and adherence and compliance with these measures are going to be very important as we get into, whether we want to call it the second wave or the second peak, but certainly as we get into the flu season and the winter season, which comes with its own challenges of gathering inside, of being in confined places, and the risk of having the flu. So these are the projected models that we look into as we prepare our strategy. So whether we're in a second wave or experiencing a continuum of the first wave, our strategy at Wayne County is to test, detect, prevent, and prepare. And we certainly have done a lot in terms of the testing. We have initiated pop-up community testings in early May. We are doing employee testing, doing inmate testing at the county jails, and we have launched 2 projects for expanding testing capacity. The pop-up testing, so far we have been partnering. As of 2 weeks ago, we were partnering with the state of Michigan and the Michigan National Guard. We were told that the Michigan National Guard were no longer able to assist us because almost 75% of those that were volunteering were tested positive. So this is where we stepped in, and we were able to conduct our own community testing 2 weeks ago. And it went very smoothly, and it allowed us to continue that. So one thing that we are seeing is that in May, we started with 1,200 tests, but the last time I think we were in Lincoln Park, we had 250 tests only, although we have the same capacity to process. So there is that sense of fatigue amongst our constituents, amongst our residents, that they are thinking there is no longer that urgency, and they are being a little bit relaxed about it. I think this is going to change, especially as we are seeing the trends where cases are increasing and more in communities. So we are preparing for that surge in terms of the pop-up testing. All the locations are determined based on the needs, population, the vulnerable population, barriers to testing, and the case numbers as well. Our employee testing, as you all are aware, we started with a project at Garden City Hospital, which is still happening. We use some of the CARES funds. It provides testing for all Wayne County employees at no cost to the employee, as well as it provides testing for the public. As you can see on the bar chart on the right, these are where most of our employees that are getting tested come from. You can see that mostly it's public services, as well as the sheriff office and the Third Circuit Court. We have done so far close to 15,000 diagnostic and antibody tests that were administered to our employees at Garden City Hospital. Memorial Health System, you just had an item on the agenda. These are the ones that we are doing at the county jail. We are testing all the sheriff deputies, as well as employees and staff at both the county jails, the 3 divisions, as well as JDF. It started on November 2nd, and they will have the capacity of performing 500 tests per day, and we are recommending bi-weekly testing for those that are at the jail because they are at a higher risk. The inmate testing also started immediately in May. This is also part of the agreement we have with Memorial, and we have expanded that for the next phase. These are some of the numbers we have 2 phases. In May, we were doing mass PCR testing and we performed close to 656 inmates were tested. And then starting June till now, we are performing PCR testing on every inmate that is booked and after the 14-day quarantine. And this is something that is currently in place. The two new projects that we are doing is expanding testing capacity in Wayne County. Part of the recommended methods to suppress the transmission is to detect cases early. And for a county our size, we need to have the capacity of performing 8,000 to 10,000 tests per day. And that is not easy to accomplish. It requires a lab with certain specific capacity and machines and all the reagents and all that. So we put some of the CARES funds, close to $5 million, and we split it between two vendors that are going to have 7 sites in Wayne County, including 2 mobile units that can travel to any community we want on a set schedule and perform the tests. Both vendors will increase our capacity to close to 8,000 tests per day and beyond, with a turnaround time for results that is from 24 to 48 hours. One thing that is also very important, as Mr. Chair, you are very passionate about the social determinants of health, is that we wanted to link a social care to these projects. So we have 2 groups that started this. D Group International is doing 3 fixed sites. One is at Dearborn Heights, one is at the city of Wayne, and one is at Lincoln Park. And then they will have 2 mobile units that are going to be in operation in mid-December. And those are going to go to community centers, churches, senior citizens, residents, wherever we think there is a need and there is a barrier. This is where they will go and collect the samples and analyze those. But also they have a component that is the social care, where they are going to screen all those that are tested. And they also have a 24-hour hotline that is going to ask for basic necessities such as food, social isolation, shelter, financial assistance. And they are going to establish a network of community organizations and partners that we can refer those that are in need for such services. The Memorial Health Hospital is the second vendor where they will establish a reference lab on the county, within Wayne County, that would increase the capacity to 4,700 tests per day. And then an additional 3 sites, these are semi-permanent sites that we are close to securing and finalizing where they're going to be. So with both vendors, we are going to strategically establish an increased accessibility for testing, as well as increased capacity for testing, including some social services that can be tagged into. The second part is you tested and now you are identifying those positive cases. Then what do you do? And this is where we're increasing our case investigation and contact tracing capacity. As we are seeing more cases, we're seeing 500 to 600 cases a day. And these are things that we need to address within the first 24 hours. So we have put some of the fundings that we got from the Michigan Department of Health and Human Services to use, and we hired more staff, 33 case investigators and 24 contact tracers. We're still assessing our capacity to see whether we need more. And these are working 7 days a week, on average 12 hours daily. We are able to complete our cases in a more efficient way. We still have challenges in terms of calling people that will not answer. People might not recognize a phone number. People might be hesitant to, when they hear someone from the health department or calling them, and they might feel a little like you're here to blame me, or you're here to make me snitch on my friends that I've been around. We're trying to do some media awareness, campaign awareness. We certainly count on you, the elected officials, to make sure that our communities are aware. If they get a call from a public health worker, then it is certainly not to accuse them of wrongdoing. It is certainly not to blame them for anything. We are there to make sure they are safe and those that are around them are safe as well. And then we have the prevent and prepare, and I'll let Carol take it from here. Carol, if you want me to navigate, advance the slides, let me know.
Great, that would be very helpful. Thank you. Yes, and so as Dr. Hamami has said, now we're on that prevent and prepare part of our whole plan. We can go to the next slide. So public awareness. And, you know, this is really, I even remember when all of this started. We started right away with doing presentations to our own, you know, management and leadership, you know, right here in the county. Everyone needs to be aware of COVID-19, what to do with it's coming, it's a pandemic, you know, and how was the county preparing, and that has not stopped since then. You know, it's involving our community stakeholders. It's internal and external communications. We send out, you know, internal e-communications from me where, you know, I'm as a health officer, I'm reminding all of our staff, continue wearing your masks, continue wearing your mask, continue with social distancing, don't have the backyard parties, you know, even this, I'm saying to everyone this Thanksgiving, having the family over and having it be, you know, the 20, 30 extended family members for Thanksgiving. This is not the year to do that. So we have just been, it's all that education, internal, external, and, you know, even very actively, especially with the city of Dearborn, we have weekly calls where it's working on the plan for, you know, getting out the information in Dearborn. And then we also have a very comprehensive media campaign that has a couple of different phases, and we're identifying multilingual messaging that is going to be very effective, you know, targeting on those communities in Wayne County where we're seeing the higher numbers, and then also with that language barrier. And as Dr. Hamami mentioned earlier, even our case investigators, we're bringing on case investigators and contact tracers that are bilingual, which helps with that, you know, case investigation interview. And then also the African-American targeted at-risk communities, you know, making sure we get our media campaign out to, you know, those communities too. And the launch and duration of that campaign, the launch should be coming soon, and that will go through certainly the winter months. And then public health information and orders. So we receive reports on, you know, our cases, our trends, the outbreaks. We're working on, you know, we look at all of it as a big picture, and then even individually, you know, as far as those metrics for COVID-19 here in Wayne County. And with that, under my authority, issuing Wayne County public health orders to emphasize and restate that we still, face coverings are required, social distancing, limitations on the size of gatherings, the health screenings and reporting rules for businesses and for schools. All of that is still in place in Wayne County, and we have worked very closely with our Corporation Council to then issue orders here in Wayne County so everyone is clear. Things remain the same. And okay, and then schools. So we have been partnering with RISA and the schools basically, and the city of Detroit for return to school roadmap, a virtual binder. I will take a moment to brag. When we produced that virtual binder, we even had the state of Michigan call us and say, that's a really nice document. Can we borrow that and use it as an example for other local health departments? And this is really helping schools for that safe, you know, return to schools right there in October. And as things have been, you know, moving on, we've established a scoring matrix to be able to evaluate if a school district is ready and there are appropriate mitigation measures that they have instituted in their schools. And then the last piece is the community risk dashboard for the school districts to use. Again, another tool and a guide for them to determine, the superintendents and the boards of school boards, to determine the appropriate model or mode of instruction in their school district based on the risk level of community spread of COVID-19. And compliance monitoring, we have a team that does go out for educates and follows up on any complaints that we receive. I will tell you, many of those complaints are, you know, businesses where they are not requiring patrons and or employees to wear masks. We have 9 compliance specialists who go out, respond to those complaints, and ensure that a business owner understands the current rules and then follows up with, making sure that then they are complying with the, like I say, especially it's masks. And they also are assisting, again, those local school districts in reviewing those mitigation plans for the schools. Flu vaccine. So we have over 1,000 doses of flu vaccine. We have already started rolling out with drive-through clinics for Wayne County employees at Wayne County road sites. I called up Bev Watts at Roads and she said, I like it. I like the idea, Carol. That's great. We always used to come down to the Guardian, but for the safety of the staff, and we just know not as many employees are even working at the Guardian, and we wanted to get out and get the flu vaccine available to our Wayne County staff. We also have flu clinic hours at the Wayne Clinic out here in Wayne, and then at the Hamtramck FQHC clinic. We have, we're working also with Eastern Michigan University for doing flu vaccines and clinics in populations where Asian American and Arabic populations, they've gotten a grant and we're partnering with them to do drive-through flu clinics there.
I will just add that all our testing sites that we mentioned are also offering flu vaccines for those that are coming.
Yes. And the last piece is the prepare. So this is where really the emergency preparedness team is, taking this lead. Logistics, it's everything from, we were working with the National Guard team for our testing events, getting all the volunteers, together every event. There are great parts about it and we have lessons learned. So we do after action surveys and, make every event be almost better than the last, smoother, running very organized. And then the emergency preparedness staff is also really helping us with procuring the disinfectant and cleaning supplies, for all the elected officials, offices early in the pandemic. And now a lot of that has gone over to our Homeland Security Department. And then we are also working with face masks. We have face masks, cloth face masks for both adults and children. And then we also have face masks for neoprene masks for our first responders, our sheriff's deputies, and through donation from, I think it was Ford Motor Company, we have disposable face masks. We have a very comprehensive mask distribution plan to get those masks out in the community, make sure those masks are getting to those communities where they have the highest need for the masks, and the availability for masks is, a challenge for those communities. And then as Dr. Hamami had mentioned earlier, those whole social determinants of health, Gleaners Community Food Bank, working on the distribution of food programs, schools and families, so that, we are taking care of more than just, testing people for COVID-19. This whole pandemic has affected many of our families, many of our, in multiple ways. And preparing for the COVID-19 vaccine, this is right on the forefront. I'm sure many of you all heard Pfizer having notified that they have a vaccine that has 90% effectiveness. We have been talking about the COVID-19 vaccine for months, I can say. We are embarking on a wonderful partnership with our major health systems here in Wayne County to make sure we're coordinating plans for the receiving, the storing, and the administering of the vaccine. There's so many different pieces to this, and it's really, we will be effective with our community partners having all of having all of this plan coordinated. So I'm very excited about this piece of our COVID-19 response, and especially working with the healthcare systems. So as we started out, we're experiencing this upward trend in COVID-19 cases, and we are preparing for this, another surge in the cases. We are emphasizing on testing, detecting, preventing, and preparing, so we're ready. And then once that vaccine comes, as I said, we are working with our community partners to administer and distribute the vaccine, in our communities. And I think that's it.
unmuting myself. Thank you very much. Thank you. Pretty thorough presentation. Let me go around to committee members. We'll give this a try, see how it goes. You can give me feedback for subsequent meetings after this if this is not the right way to do it from committee members. Commissioner Marecki, do you want to start us off on questions on this report?
Sure, thank you. I just have a couple questions, and welcome back, Dr. Hamami. It's nice to see you. I didn't even know you were back, so that's great. But I have a couple questions. The increase of testing, are these people that are coming to be tested asymptomatic or symptomatic? Would you say? Would you know the percentages of each group?
We do have a questionnaire, and we do record who are coming because they have symptoms and who do not. I would say, without looking at the raw data, it's probably 50-50. We do have those that they wake up and they feel a little bit funny and they decide I'm going to go test it. But there are those that maybe their job requires that they put them more at risk. So we have a lot of healthy people, and even sometimes walk in rather than drive through, especially when the weather is nice. We would have someone that says, well, I don't mind, I want to get tested. So I would say it's a combination of both. But normally, you would have either an exposure, you suspect that you have been exposed to someone, or you are feeling a little bit different and you want to confirm that. So these are the two major cases.
Okay, because when you were talking about, the cases are higher now than it was at the beginning, because at the beginning at that time, those numbers were coming out. Those were pretty much all symptomatic testing, right?
Well, because we had limited testing capacity, we were targeting those that are really sick and those that are at very high risk. So yes.
Okay, so even these numbers appear to be going up, but maybe 50% of them are asymptomatic or whatever. Okay, so I don't remember who I heard from this, someone at the county talked about that they think 75% of county citizens are wearing masks, which is a very good number. And I don't know if that's in comparison to other counties. I don't know, why that's determined to be a good number. But it seems like the lockdown didn't really work. I mean, if we're going back up again, it didn't really work. It might have worked for a little while to stabilize the hospitals, but it's all going back. So do you think that if let's say we get 100% mask covering in all Wayne County, do you think that would really put us down to 0? I mean, that's an extreme, but is that the biggest factor? Is the mask wearing at this point?
Yeah, I don't think realistically there won't be a zero unless we do something very drastic where people are not going out, period. But certainly we know from other countries that have gone through this, other places, the science, that the 3 measures, which is the face covering, physical distancing, and maintaining hygiene, have contributed a lot to the drop that we have seen. The shutdown, as you said, helped in flattening the curve. And we saw that with the ease of the restrictions, we are looking at an increase. So we know that this works, but the question, and it's not my decision to get into that, and I know it's very political as well, whether we should continue shutdown or not. But I think the 3 major things which are common sense, whether we're dealing with anything that is communicable disease, is we want to break the chain of transmission. Breaking the chain of transmission means being responsible. No big gatherings where parties among the youth that are going to Halloween parties and prom nights and all that, not wearing masks, mingling with each other. And we do understand that everybody is so tired of this. But the issue is you are bringing that back to your house. You are bringing it back to your elderly parents, your grandparents, and these are the ones that are going to be at risk. And these are the ones, as you said, that are going to manifest the disease in a more severe way. So these are the things that we are advocating for, is be responsible, wear a face mask. I don't know whether we can quantify how many people are wearing a face mask, whether it's 75% or 90% or less, but also wearing a face mask properly. So not having it as a beard where it's sitting on your chin and not exposing your nose is certainly something that I see a lot of people are not wearing it properly. So again, this is where driving the message that you have to be responsible, not only for the sake of others around you, but also for your own sake, and certainly for the sake of your loved ones that you might go back home and bring the virus to, that may not react in the same benign way that you have. So I hope that wasn't a very long lecture in answering your question. But
that was helpful. I appreciate that. And my last question is for Carol. These cloth masks that you were talking about distributing, they're going to be in distribution centers, like in different areas. Did I hear correctly that there's like a mask for every single person in Wayne County?
Hi, yes, we have procured many masks, and yes, it will be a very, we're finalizing up the steps of that distribution plan. And yeah, they will be put out, a lot of it is using many of our locations that we've used for even like the water filter distribution, these sites where we know even with our pop-up testing sites where people can come drive up. So yes, we will be throughout the county and in the communities. We've making sure that the communities where there is the most need and the biggest need also for, the biggest challenges even for getting masks are more on the top priority communities, but then throughout the whole, county. So yes, it will be a very comprehensive plan that is getting those masks out to the residents rather than, so they'll be convenient for them within their own, neighborhood and community.
Okay, and those are washable. Those masks are washable.
Yes, they are.
Okay, well, thank you very much to both of you. I'm all set, Mr. Chair.
Thank you very much, Commissioner. Commissioner Dobb, you have questions, please?
Yes, Mr. Chair, I do. Thank you. So all of my questions are in regard to schools, public schools. So first of all, you talked about compliance monitoring. If I have received an email from someone in my district about their concern about children going back to school face-to-face or the hybrid model. And so what should we be doing as commissioners with those complaints or concerns?
Right. And as I said, the school districts that are currently have any hybrid or face-to-face, they have all submitted comprehensive mitigation plans that we have reviewed and gone over, and they've even gotten a score for their mitigation plan. So we certainly, that's one piece. And then secondly, ultimately the decision for the instruction model that a school district has is up to the school district. But with our dashboard, where we have every community in Wayne County with the score for the community transmission level, it goes from low all the way to E being the highest, or kind of like a bad grade. The school districts, all the superintendents are aware of that, and then we able to have consultations with them on how those numbers, how that score was achieved, what their numbers are, what their transmission in the schools are. So we are in very good communication with the school districts, but ultimately, like we said, that decision on the instruction model and, what they are going to choose, and there is a state decision-making matrix also that we use as part of, with that COVID-19 community risk level. So they look at their risk level, then they go to the state decision matrix, and they then ultimately, it is their decision, but we are certainly there to consult and help.
Okay, so we're just there for the guidance and to provide the information, but we are not going to say Plymouth Canton schools or any other school district. I'm just using mine as an example.
Right.
You cannot go back to face-to-face instruction at this time. Like we
Right.
don't do that as Wayne County. Okay, thank you. And then my next question, sorry, I'm just reading through
Oh,
my
no.
scribbled notes, trying to read my handwriting. So the school risk dashboard that you mentioned, how often is that updated? Because I've seen some complaints from parents on social media saying that they don't think it's updated enough. Is it just every other week that's updated?
Right.
It's every 2 weeks, Commissioner. So,
Okay. Is there any plans to get that updated more often? Just because things are changing so rapidly these days?
Actually, we did have it on a weekly basis, but because one day you would have a community that have a spike in cases, and then the other day it would have a drop, it was affecting the rating. So a school would be, let's say, at A, and the next week it would be at C. And that would put a challenge to how they would operate. They cannot open 1 week and go back the other. So we spread it over 2 weeks to watch the trend and whether we can minimize that fluctuation. And we found that it works in a practical way better, and that's what we are using. So again, as Carol mentioned, our role is to calculate the data and assign the risk level, but then the matrix that the state has put, and this is where maybe some people are looking at the matrix which does not change. That is something that the state has put, and it has recommendations that says, if you're at level C, here's what I recommend you consider. If you're at level E, here's what you recommend to consider. So these are the things that every school district would take their letter that is calculated based on the risk, and based on whether we say they have the proper mitigation plan in place or not, they make the decision. Because every box of that matrix, if you're familiar with the school matrix, every box says with proper mitigation. And our role was, and I think the schools were very happy with us putting a structure in place that tell them whether they have the proper mitigation or not. There was a lot of guessing before that. Now this made it much easier because they can have a checklist and say, we have all those in place and we are able to do that.
Okay. One final question. If there is an outbreak within the school, or even if one child or one staff member is infected, test positive for COVID-19, how is that information given out to the families of the children who attend the school and the staff members?
Right.
Is that up to the individual school district, or are there any guidelines that
Yep.
Wayne County or the state have set to do that?
Yeah, actually, remember I mentioned that virtual binder, and in that binder, there are form letters for the schools to use for, there was a staff person who was tested positive, or the student, yes. And my understanding is they use them, they love those form letters. And then they have such a good communication method, where they've got emails, they blast those letters out. So no, absolutely. And, when we were developing that binder, that was one of the requests. Can you please give us, a form letter to use? And we did. And that has worked out, like I say, that part of this whole, with the COVID-19 response, and especially for the schools, has worked very well, very well. I've only received compliments on that part.
Okay, great. Because I know they probably have to be careful with not disclosing too much information.
Yep.
But
Oh,
they
yeah.
do want to provide enough information so
Mhm.
that families can be.
They will never disclose the names. They will just mention it. And the reason I know that, I just got an email, I think yesterday. My son goes to Livonia Public Schools, and we got an email that only says there has been a case identified in Livonia Public Schools, and we are notifying parents.
Okay, will they tell you which school the case was identified in? Or is it just the school
I
district?
don't know, Carol, I think they do probably.
I think, yeah, they would, you wouldn't just say the whole, any, school district. The letters, they should, identify the school. Yeah.
Okay, that, I think that was all my questions. Thank you very much.
Thanks.
Thank you, Commissioner Dobb. Commissioner Anderson, coming to you, sir.
Thank you. I just wanted to ask, I've got a couple of questions. One of them is, as far as religious facilities and just churches and other worship facilities, what are we doing with those groups? And are we surveying to see, the compliance of large crowds or how they're doing them, if they're doing them by Zoom, or do we have a handle on that, Carol?
And my handle is pretty much as far as, complaints, and we have not received, since, maybe very first in the beginning, the religious institutions, I think, and many have, already, they have decided like at 50% capacity, and that is still the case. We are not hearing of complaints on religious, gatherings, services. And I will say, it was probably a few when a lot of the capacity, things were changing. We did reach out to the faith-based and make sure they understood, what the capacity limits were. But we have not gotten, like I said, that is not an area there where we are getting complaints about.
And
Right.
Commissioner, I can add as well that in our case investigation where we encounter an outbreak, I don't believe, and Carol, correct me if I'm wrong, I don't believe we had any cases linked to a church or a mosque or a religious gathering.
Right. No, we have not.
Okay. Yeah, I realize we haven't had the large numbers of church members coming down with it, but I do believe there in the city there was either a father and a son that both died from COVID, and who knows though if it was something that spread within the congregation. I'm not sure. I didn't hear anything about that. Certainly not like we've heard from some states in the South, what's happened there. And as far as the report that comes out, the daily reports, I appreciate that. I just wonder if there's any more detail we could provide in that simple form that goes out daily that originally Carol was sending out. If there was something as far as those that have contracted, been hospitalized, and have since been discharged. I don't know if we have any ability to put together something, because that's one of the things that I hear from people, that they really don't have a sense of what, who is infected and staying in the hospital, the discharge rate of those that had been admitted due to COVID. And I'm just wondering if there's some other, format or adding to that format, because people seem to like that format, that they're able to determine at a glance if their community is going up or going down, if the death rate is going up or going down. And I just wondered if there's anything that could be added to that to reflect, because I know I hear a lot of, not a lot, but occasionally a complaint that it's not reflective of those that are discharged from the hospitals, and who actually had to be hospitalized from those that were infected, and then who is able to be discharged.
A great point, Commissioner. And at some point, specifically in my previous life, in my previous role, we were able to get the recovery rate. We are able to provide, similar to how you have a mortality rate, a positivity rate, there was a recovery rate. However, I am not sure whether we can have it to a county level. We can probably get that to the Michigan level, but we certainly can look into that. And if it's something that does not require a lot of data crunching, then we certainly would look into.
Okay. And I do want to say thanks to everybody involved in all the hard work. And I think the effort is certainly a Herculean task to stay on top of this and to be able to help keep people informed. I think for, we still see those that are in denial, but I think as they see the evidence on a regular basis, they realize that it's still there, it's present. The infection rates are going back up. What's I guess a two-sided sword is that as the death rates are not increasing like they were earlier, some people may treat it not as seriously. They see the infection rate going up, but like I said, I think they become less stringent on what they're doing themselves to protect themselves and others. So, but I appreciate that, and I appreciate all the efforts that you guys have put into this.
Thanks.
Commissioner Anderson, you still have the floor. Are you good?
I'm all set. Thank you.
Thank you very much, Commissioner. We'll go to the committee vice chair, Commissioner Baker McCormick, for questions, please.
Thank you, Mr. Chair. I had a few questions. So as far as enforcement goes, where there are businesses that violate the protocols, what does enforcement look like?
That's a very good question, and one that actually we are working with Corporation Counsel and with the state on, as far as, what are the, like you say, the legal enforcement, jurisdiction and ability that Wayne County has. So like I say, that is something we are looking into. But again, as one of my slides was, I can tell you, we have always been very diligent on following up on any complaints. Many, many times we found it was education of that business owner, or, on here are the capacity limits. Here's the requirement about masks. Here's the requirement about the daily health screenings. So, but that is a good question. And I can tell you, we are looking into that further as far as, what would be the mechanism and the jurisdiction of the county.
Yes, I would really like to know that. I received a couple of calls about some businesses that, just they don't do any of the suggested regulations or reforms as far as COVID is concerned.
Right.
And if we aren't putting any information out in the community that says, well, these are the ramifications if you don't, obey, then I think that's why some businesses and individuals don't really follow the rules. So once you do have that, I would be interested in seeing what that looks like.
Yep.
And I think you alluded to earlier that you were pushing to assist in other areas of health and not just COVID. One of the concerns I had in that area is the dental issues and other health-related issues that I think people are not really seeking the help that they need because they're afraid to go in due to COVID. Is there any type of campaign in place to ensure that the hospitals or clinics that we have are safe and that we welcome patients for any medical reasons? And then the second part of that is the dental program. what are we doing in that area?
This is a great point, and it is something that we certainly saw early on during the pandemic, where a lot of people were afraid of seeking health care for other reasons because they were afraid. I think we kind of overcame this, and with the reopening of health systems and the measures that were put, every hospital did embark on their own campaign of proving that they have the measures in place and they are safe and all that. As it relates to us specifically in public health, we have switched many of our programs that do not require interaction or face-to-face, but our clinics are still seeing patients on appointments. They are still providing care. You heard about our clinic in Hamtramck, the clinic in Wayne, that are still providing primary care and assistance and all that. And everything is done under strict safety measures and precautionary measures to ensure that our patients as well as our healthcare providers are safe. The dental component as it relates to the county itself, and I don't know if Mr. Coaches is still on, we had a halt during the pandemic, and that was originally a partnership with the University of Detroit Mercy, and they were struggling after we told them we want to reopen and it was safe to resume operations. We're struggling in identifying a dentist to allocate to that location. I think we are very close to a resolution, and once that is a dentist is identified, we will resume our operations at the Wayne Dental Suite at our clinic. And also another plug for the Hamtramck side, they are starting an expansion where it will, construction is underway, where we will have 5 chairs added to that clinic. So we'll have 2 major locations to provide affordable and accessible dental care under those safe measures that you just alluded to.
And I'm sorry, when did you say that would open for the dental program in Hamtramck?
Hamtramck, it's still there. They're expanding, so it is. There is construction happening, but we expect the clinic in Wayne to, as we are continuing to talk with the University of Detroit Mercy, it seems that we might be able to resume that soon. I don't have a timeline, but I'm hoping it is weeks rather than months.
Okay, great. And as far as demographics, originally COVID really hit the African American community very hard. In particular, my district, we lost thousands of people. And do you see the numbers in the African American communities high still, or are they leveling off, or is it still hitting African Americans harder?
They certainly dropped. We based on the weekly average that we are seeing, the percentage of African Americans is close to 7% of all the cases we are seeing. The majority are Caucasians, between 50 to 60%, and then the rest are distributed amongst other ethnicities. That is still, we would like to see all come down, but we certainly are not seeing the early numbers where African Americans were in the 30% and 40%.
Great. And as far as employees of Wayne County, do we have a number of the employees that were diagnosed either as for the antibodies or just having COVID? Do we have numbers for county employees?
We do get those if they were tested at the Garden City Hospital. We do get the data from Garden City Hospital. Unfortunately, if they decide to go to a private lab or they go to an urgent care, we do not get those unless an employee disclosed that he or she is positive and they need to take time off to be quarantined. But we do have the numbers from the Garden City Hospital in terms of the positivity rate amongst our employees, and we can certainly provide those.
Okay, that would be great. And do you believe once we do get a vaccine, and I guess I'm looking at the president who went in and got this experimental treatment. Do you believe that if there are folks that have COVID and they are in intensive care and they may lose their life, that there's any way that we can expedite any kind of treatment for them?
That is a very tricky question, but let me try to answer it. So we know that there are certain life-saving treatments, and I use the term life-saving very loosely because it doesn't apply to all. But remdesivir and the steroids, the prednisones, are given in extreme cases that have proven to lessen the severity of the disease. I don't know if you heard the news this morning. There was a talk about a monoclonal antibody that is done by Eli Lilly that can prevent mild cases from progressing to a degree where there has to be hospitalization, and it is effective. So that is encouraging. And then we also heard about a vaccine that is 90% effective in preventing the infection itself. So combining all those, if we put all those in motion, then we probably are looking at much better outcomes as we progress. Of course, with vaccine, it is only useful if people get vaccinated. If people are not willing to get vaccinated, then we are still going to be where we are. So this is, again, our public message is that if a vaccine is available, and we have heard that it is effective and it is safe, then we encourage everybody to get vaccinated. They have access to that vaccine.
So as far as the life-saving treatment, if I had someone that reached out to my office and said, you know, my family member needs these meds, and how can we get them for that individual? Is that totally up to the hospitals, or is there a way, again, to expedite or to get these other alternative treatments?
So, as far as I know, all the treatments and the medications are given to the hospitals at a certain allocation. There are certain criteria when to use them, certain clinical protocols and all that. We as public health do not have any leverage or interference.
Okay, so most hospitals have the ability to get or have access to those drugs.
Yes.
Okay, and my last question is in reference to the vaccine. My understanding is that when the vaccine is finally approved, there will only be so much of it to give out. And is there a system that you know of how we will, as a county, have the ability to get the maximum amount that we can to ensure that we can give our residents the vaccine timely?
Yes, the short answer is yes. We are working, as Director Osterberry mentioned, we are working with the state. We were notified of 2 vaccines. The first one that everybody knows is Pfizer, and that is coming before the second one. That one is coordinated by the state. They reached out to all health systems across Michigan, announcing that they will get that the state is getting a number of doses, and they're asking the health systems what are their needs and capacities. They also reached out to county health departments, including us. We responded, and that's what Carol was mentioning. We communicated with many of the major health systems within Wayne County, and we coordinated a plan where we sent a letter back to the Michigan Department of Health and Human Services advocating for the maximum allocation of doses to Wayne County due to the size that we have and the population that we have, also the vulnerable populations that we have, and also because of this plan where we are coordinating across multi-sectorial and systems to make this an efficient way. So we are advocating for this, and we are waiting to see what the response would be. It's all contingent on how many doses Michigan will get, and then how many doses the state can send down the line.
Okay, so it's based on the population, you basically.
I would assume so, as well as the capacity. This first vaccine has a lot of logistics involved in terms of storage. It has to be stored in a -70 degrees. So those that do not have the equipment need to purchase the equipment. They need to be able to do it. Once it's thawed, then it lasts for a certain amount of time within a certain temperature. So there's a lot of things that require such meticulous plans of how you can keep that vaccine effective. Some smaller counties that do not have the capacity might opt not to get that one and wait for the second one, which is more stable and less logistically complicated. So this is what we're looking at. However, we as Wayne County have requested to get the first vaccine in any amount of doses that they can afford.
Great. Well, thank you so much. I thank you all for the great job that you're doing, staying on top of this issue, this very important issue. So thank you so much.
Thank you very much, Commissioner. There's there's a ton of misinformation out there on this whole COVID thing. I hear a lot of anecdotal stories, including seeing a story today from The Guardian, where there's a study that says 1 in 5 COVID patients are going home with mental health problems. That was a study that was done in England. What do we know? Because sometimes this is presented as, 245,000 people died, but 9.75 million recovered, went home, no problem. But there's a lot of anecdotal information that people are going home with systemic issues. If you don't have oxygen in your body, your organs start to shut down. What do we know so far of the long-term consequences that folks are going home with from COVID?
Not much, unfortunately, because this is one of the viruses that can manifest in so many different ways, and it is completely new, so we do not have a pattern. I would be probably a little bit careful and cautious in linking causality to things. Now, being severely ill and almost about to die and being put on a ventilation certainly is going to cause you stress, and that stress is trauma, and that trauma can manifest as a mental health disorder, but so is diagnosed with any terminal illness. So are we starting to look at if you smoke, you're going to have a car accident, but if you smoke and drink, you're going to have a car accident. So this is
Yeah.
where
I
we would
gotcha.
like to draw that conclusion. I certainly would believe that severe cases, being put in mechanical ventilation is going to have some effects, but to certainly go into sequelae that are going to be long lasting, it is too early to call.
I gotcha. And is it proper to say we're still learning about this virus? It's so new.
Absolutely.
Absolutely.
There's things about it that will manifest itself 6 months from now, 8 months from now in the data that we're just not picking up on right now.
Absolutely, yeah.
I think it's
Yeah.
safe to say that.
All of the activities you're doing, is this all being paid by CARES dollars, CARES Act money?
That's a good question.
And if so,
Actually,
when does that run out?
right. The CARES Act money does end December 30th. We have to have all of that done. Now, through the state of Michigan, you know, remember that nice big CPBC contract I did get as public health. Some of the funding I got actually started October 1 and will go all the way through for the whole fiscal year. So, you know, it's been it's a combination of both is what I'm trying to say.
And we're anticipating Congress may act yet this month or early in November for another CARES Act type bill. Are we good then in what we're trying to do until December 31st
I mean, yeah,
financially?
right. We meet every week with, you know, the finance team and the guidehouse consultants and tracking and, you know, where we're at with, you know, the projects and the funding and the, you know, spending, and we are tracking it very, very closely. Yes.
Okay, but we seem to be okay.
Mhm.
Okay. There was comments before, but you know, people getting tired of COVID, getting tired of, my reading tells me this is very similar behavior to what we saw in the 1918 pandemic, that the population acted pretty much the same. When it wasn't right on top of them, they tended to discount it. The mask wearing and shutting things down, people got tired of, and they returned to other behaviors. Is this just a human thing? Does it look like when you have a pandemic like this, how people behave?
You know, I think, yeah, people are tired. They're tired of not, you know, socializing, not seeing their, you know, extended family, let alone their, you know, friends. I mean, we've got, you know, many, many stories, as, you know, Dr. Hamami mentioned earlier, we're hearing like in the schools, and, you know, a group of parents all decided to rent a banquet hall so that, you know, all of their kids could have homecoming. It was not
Yeah.
a school sanctioned event. I mean, I think that's human nature. And then that's our part, you know, as public health and making sure our messages get out to, we need to, you know, continue with wearing masks, social distancing, good hygiene. As I said, this is not the Thanksgiving to have 30, 40 people over at the house. It is the Thanksgiving to have Thanksgiving with the people who live in your immediate home and have a Zoom call with, you know, the rest of the family.
Yeah, it seems to be just humans behave this way.
Right.
Hospital capacity. I didn't see that in your numbers. You know, it was very predictable right from the start, even though it was a new virus, that give the medical community 3 or 4 months and they'll have better treatments. People will last, you know, will live longer. We'll be able to get on top of stuff quicker. Know what regimen to use. The death rate was going to go down as a result of that, even though we don't have a, you know, the fabled vaccine. But hospital capacity plays into, and I'm starting to hear this from down south, little glimmers of it in Michigan. When capacity fills up, then there's decisions that are made on other patients that come to the hospital in terms of delayed treatments that people might have. Do we have, for the state of Michigan or for Wayne County, capacity numbers so that we know what our hospital systems, what kind of room they have as the cases pile up, because this, as the hospitals fill up, this will have consequences for people that need hospitalization that are not COVID. So can you comment on that at all?
That is a great question, Mr. Chairman. And I think the reason also to keep monitoring the hospital capacity that we are getting into the flu season. And there will be a probably surge in people that are not knowing what they have and they are going to get hospitalized. So we do have access to all that data. We monitor it on a daily basis. We report it on a weekly basis. I'll give you for an example for the this week, we know that the all hospital inpatient bed occupancy is at 76%. All ICU bed occupancy is at 77%. Total mechanical ventilators use is 34%. So that means we have about 65% capacity.
This is county data, sir?
This is Wayne County data, yes.
Okay.
And morgue availability is 88%. So hopefully we will never use that, but in case of increased death, then hospitals are able to handle that. So we continue to monitor those, and usually you start getting a little bit nervous when you cross the 80% threshold. This is where health systems, the state, probably us, would start considering emergency plans. This is where, if God forbids we have a massive surge, we need to start looking at alternative sites of care. And that's where some of the plans that I am aware of that happened early during the pandemic can be revisited, and some of these can be reactivated.
Yeah, thank you. And I would like to get those numbers out to the public, right? For the understanding really of the, you know, you mentioned 75, 77%. Of course, that needs context. I'm death on numbers all by themselves without a context. You know, what kind of capacities do we normally run? Where are we at now? Yes, we will get another surge with the flu. And so I think for the public to understand and be able to monitor the growing pressure cooker that our hospital systems are under. Beaumont is changing how they're allowing people to visit the hospital now as a result of this. So I would like to see some numbers like that, and I would like us to share that with the public and give context. The problem quite often with so many things is people don't have context. They make up their own numbers. They make up their own answers to things. But yeah, I would like to see those numbers and the context, right? Like, you know, normally we're running at 62% capacity. 77 ain't good. When we get to 80, look out. I think that's good information for the public too. Are we good with PPE around the county then? Are we good?
We are.
Okay, good.
We keep a tight inventory. Homeland Security is in charge of that, as well as the HQ, and both securing what we have and also the distribution is very well managed.
Okay, thank you. Yeah. And for my last question, there's been a lot of conversation in this state, and including in the state legislature, about Governor Whitmer's policy with senior facilities and having not wards, I forget what they call it, but in certain senior facilities to have a wing of that facility set aside for nothing but COVID patients. I will agree that the optics of that is perhaps not good, but from a medical point of view, because this has gotten all sorts of attention, and my reading of it is people are misreading and not being accurate and truthful about this. Has that policy increased the spread of COVID in any of those senior facilities? Has there been additional cases because we have had those, and you can give me the term, Doc, but have we seen that they have contributed to the expansion of COVID or more unnecessary deaths?
Um, as I'm back into public service, let me be political in my answer. The short answer is no. And we have seen hospitals that switch completely to COVID-free and COVID units, which makes sense because you are not mixing those that are at risk with those that are risk-free. So establishing those wings where you have, it's kind of like quarantining them in a special wing, and where you're minimizing the spread to the healthy population, i.e. healthy, that do not have the virus. So this is basic preventive measures that we learn in public health and in preventative care. Did it contribute more to infections? I would doubt it if it was done right, where those cases are handled with all the isolation measures that need to be done, then that should have not posed any risk to anybody else.
Yeah, because what I'm probing for here is, of course, they're putting COVID patients in senior facilities, right? And when you throw that out to the public, it sounds like this is just like crazy. This is killing people, especially in existing senior facilities. I have not seen any evidence that that has increased transmission at all or turned those facilities into a hotspot. Have you seen any of that from where you sit?
I can say, and no, we actually track our number of cases in all of the long-term care facilities every day. And we even have a compliance team that goes out and does unscheduled, unannounced, just compliance checks on all of those facilities. We started that months ago at the beginning of this pandemic. And I can tell you that, yeah, the number of cases in the long-term care facilities, and also the other piece is the Governor and Director Gordon also months ago put out an order about testing. So if there is a positive case, then they have to test all residents and staff every week. And when that testing mandate came out, I can tell you that really took those number of cases. We virtually almost, it's a surprise for me when I see any cases in the long-term care facilities.
Yeah. Well, that's almost mixing and matching also a little bit there, Ms. Osterberry, that, yes, seniors are vulnerable, so you're going to have cases in senior facilities, and we still have them. What I'm trying to get at is in a senior facility that also has one of these segregated wards, is transmission taking place outside of those wards to the rest of the, yeah, and I think people misunderstand that and use it perhaps for other purposes other than public health.
Right.
I'm going to ask my fellow commissioners that maybe another question has occurred to them before we wrap this up. So Commissioner Dobb, do you have any last questions that you'd like to ask here?
No, but this was a really great presentation. Thank you for all of the information. I feel like it's kind of been a while since we've done a really comprehensive discussion of this issue, and we need to really, get back to this and remind the public and everyone that COVID-19 has not gone away, and in fact, it's our cases are rising, and that one graph that we saw at the beginning really outlined that we're at confirmed cases are higher than we were back in March. So we all need to do our part to wear a mask, wash our hands, practice social distancing, especially now that, winter's coming up and we are, we're going to want to be with friends and family in our homes, and we need to stay vigilant and be safe. Thank you.
Thank you, Commissioner. Commissioner Anderson, do you have anything before we wrap up?
I don't. I appreciate the presentation though.
Yeah, thank you so much. Commissioner Baker McCormick?
No, I don't have any other questions. Thank you.
Okay. I want to thank both Ms. Osterberry, our health officer, and Dr. Hamami, who I believe is our COVID coordinator, for coming to the commission today. I think this is very helpful to commissioners so that we can be telling the correct story out there, and also for the general public, and however this gets picked up and gets out onto the Webernet.
Mr.
I
Chair,
do, yes.
this is Ilona Varga. I
Oh,
was
Commissioner
wondering-
Varga, I'm sorry, yes.
Thank you. Very good meeting. I've been listening from the beginning and appreciate the presentation. I was wondering, as I start listening to the 76% hospitalizations, where we are currently, we're looking really good. What are the numbers that we're starting with as far as hospital beds are concerned? What is the capacity of our hospital beds?
Yeah, so just to be careful in using these numbers, 75 or 77% are not COVID cases. This is what hospital beds are occupied for any case.
Okay,
Of course, the capacity is 100%. And if we look at Wayne County, total hospital beds available are 2,694 hospital beds. Total ICU beds are, I think, 184, if I'm reading this correctly. So these percentages are available occupancy of those hospitals across all health systems. So we can break it down to Henry Ford, Beaumont, St. Mary, blah, 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 all those. And we can see who is at capacity, who is less. So again, in hospital management, I guess, when you are dealing with a crisis, a pandemic, something that you need to be prepared for, once you get into the 85% capacity and your projection shows that you might have more, then you need to start planning. If you recall, during the early cases of the pandemic and the two graphs of flattening the curve, the only reason why we were advocating to flatten the curve, because we were expecting if we reach the peak, then hospitals would be required to be at 400% of their capacity to handle cases. Fortunately, we never reached that. We didn't even hit beyond the 100%. But as my role when I was at the health system where I was in the past 3 years, we were preparing all our hospitals nationwide to accommodate 200% of our current capacity. That meant we have to shut down every other wards and make them available. We have to turn places such as alternative sites, hotels and cafeterias and blah, 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 and consider those in case we needed them. Again, we are so fortunate that we never reached that, and flattening the curve happened where the health system capacity was able to absorb that. And this is exactly what we want to see.
thank you. That helps a lot because that sort of gives the percentage of people utilizing it even without COVID. It really is good information. Thank you very much, Mr. Chair.
Yeah, thank you, Commissioner, for joining the meeting today. And I'm just going to follow up real quick on that, Dr. Hamami. If we went back and picked any day in 2019, what's basal? What is normal hospital capacity on an average day when we don't have a pandemic?
I really cannot answer that.
Okay.
Because it might be they're high on elective surgeries and they might be high on different things. So
Yeah, I was just looking for a starting point. So when people hear 75 again, I want to thank Dr. Hamami and our health officer, Carol Osterberry, for this very great presentation. As I look down the line, you know, we have Christmas coming 2 weeks from now. The committee is going to be looking at all things solid waste in Wayne County. And in our meeting in December, we're going to be discussing, we will have the chief judge for the for the Juvenile Division of Third Circuit to talk to us about our juvenile justice programs. So I would assume, Ms. Osterberry and Dr. Hamami, as we go back to your first graph and look at where there might be a peak, that's January. I would be reaching out and requesting that in January, we get another update like this. So I'll be reaching out to folks, but really appreciate the presentation today and a better understanding of what's happening in Wayne County.
Mr.
Thank you.
Chair,
Yeah,
Mr. Chair.
Mr. Anderson.
I just, food for thought, I just received an update, and I'm sure Carol and them have it already, that the infection rate hit a new high for the day. So it's certainly, if anyone had any doubts, it's alive and well. There's been, as of today, the state of Michigan has announced 6,473 new confirmed cases today, setting a new record. And
Wow.
so it's, if we had any doubts, it's still with us and going strong.
Yeah.
Thank you.
Well,
Thanks
that's
for-
why even with death rates down, hospital capacity worries the
Right.
heck out of me.
That's
Thank you
it.
for that, Commissioner.
Thanks.
If nobody else has anything, I'm going to move the agenda. Item E, Madam Clerk.
E, such other matters as may be properly submitted before the committee.
Has anybody submitted anything? I'm not aware of any. Okay. Moving the agenda. What's next, Madam Clerk?
Public comments.
Okay. If you could open the phone lines, please, so that anybody that has public comment. As we open the phone line here, you still may have self-muted yourself. You may have self-muted. Are the phone lines open now?
Yes.
Okay, so if you do want public comment, please make sure you're unmuted. I'm going to ask first if any emails have come in. Have we received any emails for public comment?
No emails have been submitted.
All righty. And then the public that's on the phone, please unmute yourself. You will have 2 minutes to have your comments to the committee. Comments are exactly that. This is not a back and forth discussion. After you've had your comments, if there are things that needed to be followed up on that you mentioned, we will follow up on them outside of the context of this meeting. So do we have anybody on the phone that would like to have public comment at the Wayne County Health and Human Services Committee? Is there anybody, member of the public, on the phone that would like to have public comment for the Wayne County Commission Health and Human Services Committee?
I'll just make a comment that this has been really good and really informative.
Please give us your
I
name. You don't
also-
have to, but please give us your name.
Okay, my name is Laura Monterth. I live in Dearborn in Wayne County.
Welcome.
And it's been really helpful. And I would just like to add the comment that hopefully when eventually the vaccine does become available, that there will be a prioritization given to the higher risk population. I'd like to see my 77-year-old father, for example, receive it before I would. And then also just a comment on testing prior to giving out the vaccine. And I don't know that they, since the vaccine will have been brand new, if someone who perhaps had a light case of COVID and has antibodies to it wouldn't necessarily need it. I'm not sure of that or not, but just a comment to be, looked into by health professionals and that.
Thank you very much for your comment and being with us today. Is there any other member of the public that would like to have 2 minutes to address the committee?
Yes, my name is Patrick Kehoe. I'm in Plymouth, Michigan, and I
Yes, sir.
really appreciate the presentation here today. I appreciate the transparency and the sharing of all of this information, especially the data from the Wayne County Health Department. I'm on the school board here in Plymouth Canton, and this information is very helpful for us as we have to make the decisions as to whether we're going to open or increase density or decrease density of education. And hearing directly from Wayne County Health Department is very helpful for us. Thank you.
And thank you for your service, sir. Every public office is important and has consequences for citizens. So thank you very much for serving. Is there any other member of the public that would like to have comment today? Any other member of the public would like to have comment? Well, it's last call now. You don't have to go home, but you can't stay here. Any member of the public would
My
like
name
to
is
have?
Ann Birchmeyer.
Yes, thank you, ma'am. Yes.
I just want to reiterate a comment that I put in chat. I am a pastor at a church in Downriver, somewhat, and I just wanted to request possibly a reminder letter that we can share with our congregations, because there's a lot of controversy in our congregations. Let's just put it that way. That's all. Thank
So
you.
you would like to have some materials to hand out, ma'am?
Just like a reminder, I think people are getting really lax, as it was put in, and they just think that it's not going to affect them. So any sort of reminder that just says, hey, this is still a problem, we still recommend these things, would be helpful. An official letter, I'm not joking, an official letter would be helpful.
I gotcha.
All the information.
Is there somebody from the department that could get Ms. Birchmeyer's information and be able to respond to her?
Oh, I'm sorry. This is Carol.
Yeah, I don't know how we do that in this
Right.
format, but perhaps somebody can talk to her
Yeah.
or somehow get a phone number. Can we arrange that without doing it publicly?
Right. Is she?
I think I can send a message right to Carol.
Okay.
That would be great.
That'd
That would be great.
Thank you.
And thank you for attending the meeting.